Friday, Baylor College of Medicine and friends of Baylor College of Medicine, including some new friends. My friends in New York, turns out some of my colleagues from Mount Sinai, my former chief residents and residents are watching, so glad to see you all there. Anyway, what a crazy week. Once again, only in COVID land could you have weeks like we're having. But it's an interesting thing. So we're in the midst of a surge, no question. Worldwide cases are up to 64 million, 1.4 million deaths. United States, we're leading the way, 13.7 million cases and 270,000 deaths. We are now close to 200,000 cases per day and over 2,000 deaths per day. So it is just a mess. Now, interestingly enough, we're all anticipating this Thanksgiving surge. This is before Thanksgiving. This is what's happened in the fall. And the weather hasn't been that terrible, hasn't driven everybody indoors. It's just, so what is going on? Well, I thought it would be very instructive to sort of understand what's going on by looking at a really great case that was published in the MMWR, which is the Morbidity Mortality Weekly Report that the CDC puts out. And this was a case study that they did. It was already well into the pandemic. So it was 5 months in. This isn't when people didn't know what was going on. This was August. And a fascinating case, it was a wedding. In August 7, there was a wedding reception for 55 people at the Big Moose Inn in rural Maine. And this was a couple from California. They were very interested in going to Maine to have a wonderful wedding. Now, this town has a very small population of 4,500 people, and there had been no cases reported at all. And so they were all feeling very confident. There was a limit on the number of people who could actually attend of 50. They kind of violated that because they had 55 people, but that was okay. The bride and groom came from California, and the groom's family had 7 people. They arrived on August 6th for a big wedding event, August 7th, with the reception. Well, the index case, as it turns out, was a patient actually from Maine. And that patient, or that person, came down to the wedding reception on the 7th and unfortunately developed a fever, runny nose, and cough and fatigue on August 8th, the day after the reception. So as we've talked about many times, when are you most likely to be infectious? You're asymptomatic. Well, right before you become symptomatic, you're kind of at peak viral load. And that's exactly what happened. So there's this unfortunate case. The guest comes right before they become symptomatic, peak positive case, and then they tested this patient and didn't get the result back for 5 days, so August 13th. So there's 5 days before anyone really knew what was going on. Now, this was a beautiful inn in rural Maine. They had nice arrangements, 10 tables, 4 to 6 people per table. The inn did everything they could. They were checking temperatures. They had sign up, wear masks, physical distancing. Of course, none of the guests wore masks, and there was no evidence of physical distancing whatsoever. And interestingly enough, when the Maine CDC went to investigate the outbreak, one guest told them how many people were there and sort of described it, but would not give any contact information out. Again, interesting. So, the only way the Maine CDC could figure this out was to actually do what's called reverse tracing. And that is when they find cases, they go back and say, where were you? Can you think of an event that you were participating in? And they trace it backwards rather than asking people who are the contacts and then go forward. So that's what the Maine CDC did. It's very difficult, but they did it. So in the week following the wedding, from August 8th to August 14th, 24 people became positive. 24 of the 55. And now there ended up being 27 total cases. The other 3 were a staff member, a vendor for the wedding, and some poor guy who just checked into at the hotel or the inn at the wrong time. Feel sorry for him. Now, there were 17 additional cases that are called secondary cases. So of those 30, they infected 17 more. And then there were 10 additional tertiary cases. So the secondary ones infected 10 more people. So there were a lot of cases directly from the wedding. Of those many cases, 4 were hospitalized. None of the people who were hospitalized were wedding guests. They were all sort of older, over 75 people who had been either secondary or tertiary contacts. One of the patients unfortunately passed away. So it was very, very big spreading event. But what happened after that? One person who attended the event developed symptoms on August 10th. And despite that, they went into a school meeting, an in-person school meeting in East Millinocket on that same day. And then a few days later, 2 staff members of the school were diagnosed as being positive, and they had to close the school for 2 weeks just because of that. Another attendee of them that actually attended the wedding reception infected their parent, and their parent worked at a healthcare facility about 100 miles away in Madison, Maine. That parent became ill on August 11th, but went to work with symptoms from August 11th to August 13th. In the following week, from August 19th to August 21st, 38 more people were infected, 14 were staff members, and 24 residents of the long-term facility. One other person who attended the wedding event worked at a correctional facility 200 miles away in York County. They became symptomatic 4 days after the wedding event, but went to work anyway from the 15th to the 19th. They worked 8-hour shifts in 2 different facilities. The outcome of that was 18 staff members and 48 inmates were infected, along with 16 household contacts. So an amazing super spreading event, all starting with one person from Maine that attended it at the peak of their infectivity. So what's the tally? Well, there were 2 people who got infected from an attendee of the wedding who went to a school meeting. There were 57 people in total who were infected by the wedding reception and secondarily. There were 38 people in the long-term care facility and 82 in the correction facility. So we went from a very short period of one person infecting about 30, infecting 179 in a little bit over 3 weeks. So what can we learn from an event like this? Well, the first thing is, right before you're symptomatic, you're extremely infectious. And that's been one of the problems, is people are asymptomatic, but about to become symptomatic, they're very infectious. People did not wear face masks. Even though it was said on the wall, please wear face masks, they did not physically distance, even though it was requested. They violated the limit size for gathering. It was supposed to be limited to 50. They did 55. And the other thing that we say to people all the time, stay home if you become symptomatic. Stay home if you have symptoms. Well, there was a staff meeting at the school. There was the person who worked in the long-term care facility and the jail, all of whom were symptomatic and went to work for 2 to 3 days when they were in their maximum infectious state. Also explains why contact tracing hasn't worked very well, because we Americans don't like to give information to that government. So you get somebody from the public health department that asks you a reasonable question, who attended? We're not saying. So what happens is they have to work backwards. It takes them a lot longer to do that. Look, it took 4 days to get the results back from a test. That person who was infectious stayed in the community for 4 extra days. Should have gotten a result right away and been quarantined, but didn't do it. So the importance of returning results quickly shows again. And then one thing I talked about last week, it's a series of super spreading events that really are driving this pandemic. If you look at the primary cases that were infected at the wedding, it was 24. They went to 17 infected cases of secondary infected and 10 tertiary. So their direct contacts were sort of going down. It wasn't that massive. But what happened was it spawned multiple super spreading events. Again, so one person went to a long-term care facility and had a massive number of people. One person went to a correction facility, had a massive number of people. So that was what I was trying to explain last week when I showed you the diagram. If you look at an R value of 3, in other words, one person infects 3 in 10, which is a pretty good estimate for SARS-CoV-2. It can be either very homogeneous, 1 infects 3, and you have 10 eventually infects 30, But that's not the way it happens. What actually happens is this. You have these multiple super spreading events where one person infects 27, or another person infects 38 in the long-term care facility, or one person leads to 82 infections in the correction facility. And that's why the policymakers are, struggle. Because if it was homogeneous, as I said before, we would have different kinds of policies. We would say, close down, lock down everything. People can't be out because everybody's infecting each other. But most of the time, people are not infecting multiple folks because they're wearing masks or practicing safe social distancing. But unfortunately, what happens is you have these massive events. And so, in my view, the key is get people wearing masks, limit gathering sizes. We shouldn't be allowing large groups of people to get together. That's the right strategy. You're not going to get it necessarily walking into the Kroger if everyone's wearing a mask. But if you go to a wedding, an anniversary, a birthday, a funeral, family get-togethers, those are the things. The multifamily get-togethers are really dangerous. So now let's think about what's been going on. This surge has been really dramatic. This is the fall surge. And this fall surge started in about mid-September to late September, early October. And this was, there wasn't a giant change in weather then. And, it wasn't, we haven't seen giant outbreaks in elementary school and things like that. So what has been driving this has been really kind of an enigma. We've all been very worried about the Thanksgiving surge, but, really it started in September and October. Well, it's a fascinating thing. What happens in middle of September? Colleges open up. Everybody goes to college. And some colleges took it very seriously, and some colleges not so much. So some of the smaller private schools have managed very well. Duke has been in the news a lot for having managed theirs very well. Rice has done a great job, Baylor University. Any small school that has really cut down on the number of people in classrooms, had rigorous testing protocols, really enforced face masks, not gathering, they've done okay. But there are a large number of schools, mostly large state schools, here indicated by the purple stars, that each have had more than 1,000 kids infected. And it's interesting to look at where those stars happen to be, because this is the map of all the hot spots now in the United States. And it's what I've said many times. It is West Texas, El Paso, Lubbock. Then the upper Midwest is a mess. The Midwest, Kansas, Missouri, Idaho. These are really hot spots. And I just took the opportunity to overlay that college campus opening with the hot spots. And this is what it looks like. The big white square there is the Sturgis bike rally. So that accounts for South Dakota. But it's very clear that where you aggregate a bunch of 18 to 20-year-olds in large groups who are not being rigorous around following masks and social distancing, you have these giant outbreaks. So we create these super spreader events. And I have a feeling that the thing that has driven the fall surge has been the opening of many, basically super spreading events known as colleges and universities that haven't paid attention. Unfortunately, it's a no-win for them. But then the problem is, all these infected kids, what do you do with them? Some places have been very careful to quarantine them at school, which is the right thing to do. Others have closed the school and sent them home. So guess what that does? That's a giant dispersion event. And I think that, in my view, is what's really driving the mess. Now, if you just look at what's going on in Houston, we're not doing good, but we're not doing as bad as the rest of the country. This is the surge that is happening in West Texas, El Paso, and Lubbock. The rest of the large cities are doing okay, about the same, actually. Austin, Dallas, San Antonio, they're all doing about, and Houston are all about the same. And not good. The number of infected people are over 1. It's gone up each of the last 3 or 4 days, so we're not in control of the virus. The virus is in control and winning. Our test positivity score, which was consistently under 5% for most of the end of the summer, is now consistently well above 5% and has recently been as high as 7, close to 8%. And for the last several days, we have been over 3,000 cases. Now, that's not good. That's really not good. And so if you look at it, well, was it a problem with reporting over the Thanksgiving holiday because some labs were closed and maybe it was a batching? Well, maybe, but hospitalizations are rising. And you can see that it's been stepwise, progressively. And so we're actually in for a difficult period of time. Now the good news, and I'm always looking for good news, the good news is even though we're on a sinking boat, there are rescue boats coming, and hopefully they will come in time. That is the Pfizer and the Moderna vaccine. Pfizer was just approved for use in the United Kingdom. Next week, early in about midweek, the FDA is going to look at the Pfizer vaccine. There's a 99.999% chance that it will be approved, since the UK is just like our FDA. They've looked at all the data, so our folks will get the same data, and I'm sure they will likely, they'll approve it. Moderna will probably be approved the next week, and then we'll start having delivery of vaccines shortly. The process for distribution is being worked out. Baylor has applied. All the all the hospitals have applied to be distributors, or actually to vaccinate people. We will work through that process so we can do it as fast as we can. The first 20 to 40 million people will be healthcare workers and folks in facilities, almost certainly. That's the recommendation from the national guidelines, but it's determined really at the state. The state will likely follow the national guidelines. So lots of great stuff happening, and hopefully we'll have the Johnson & Johnson vaccine early in the 2021, as well as the AstraZeneca vaccine. So fantastic information coming out. It's a miracle almost that we've gotten a vaccine this fast. We need it because we have failed as a country to come up with a way to practice public health standards and mitigate this viral spread any way other than begging for a vaccine. So we need it. All I can tell you is, again, the virus has not changed one bit. All that's changed is that we have not paid as much of attention. We decided no lockdowns are acceptable, okay. But if you're out in the community, wear a face mask. Stay away from multi-family gatherings. Nothing has changed. Until you are 1 month into your vaccination, you are just as at high risk for getting the infection as you were when it all started. So please think about that. Practice good public health practices. We're so close to winning this, but you don't want to be the last person to be infected before we have a vaccine. Anyway, lots of positives despite the horrific news on the whole pandemic around the world. We're in a very good position, and we will be in a very good position soon. A couple of shout outs this week. First of all, our health profession school has its graduation in the fall. Very excited about. We need them. Please graduate quickly and get to work. We need you. And then the other thing I want to shout out, it was the C.E. King Middle School students and their teacher, Ms. Kano, or is it Miss Kano? Or Kano, I'm sorry if I missed the pronunciation. But you all sent us this amazing video to thank our healthcare team at Baylor. It was so well done. Thanks to all the kids, and thanks to you, and have a great weekend, and I will see you next week.
Thank you for all the doctors of Baylor College and the Medicine and Texas Medical Center, because they try to do their best with COVID-19 right now and trying to make the vaccine and everything.